Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armond Budish, and from the Board of Health, we have Health Commissioner Dr. Rod Harris and Medical Director Dr. Prakash Ganesh. We'll begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thanks, Devin, and hi, everyone. Cuyahoga County is green, and I'm not talking about the environment. I'm talking about the CDC's color for low COVID-19 transmission. We're seeing lower case numbers of COVID with just 98 cases reporting last Thursday. That's good news. It's great news, in fact. But we've seen over and over again, it doesn't mean we're in the clear. As people continue to spend time together this summer, we could easily see another surge. No one knows, not even the experts know what the future holds. So I urge you again to get vaccinated if you haven't already. And take your kids with you. Children under 5 can get the shot. Just yesterday, healthcare providers began administering the vaccine to children as young as 6 months old. I know Dr. Ganesh is going to speak more on the vaccine for children. So I'll just say, please, if you're tired of the COVID roller coaster, get your kids vaccinated. This is a critical step to move our county in the right direction. You can find the closest healthcare provider offering the vaccine by visiting gettheshot.coronavirus.ohio.gov. That's gettheshot.coronavirus.ohio.gov. Okay. We're not only green, we're red hot. We're seeing temperatures in the 80s and 90s. Yesterday was the first official day of summer, so it's just going to get hotter. COVID's not the only threat to our health. Overexposure to extreme heat can cause heat stroke or heat exhaustion. Our County Office of Emergency Management is a great resource for learning about the signs of different heat-related illnesses and how you can protect yourself before extreme heat and during extreme heat. In a heat emergency, if you have air conditioning, stay indoors, stay cool. But many of us don't have air conditioning. If your home isn't cool, look out for cool places to go. For example, your city may stand up a cooling center. You have lots of options to stay cool. Go read a book in a nice air-conditioned local library. Check out a summer blockbuster at a cool movie theater, or window shop at the mall, or go buy some milk at your local grocery store. There are air-cooled options all around town. This is serious, folks. Extreme heat claims more lives each year than floods, lightning, tornadoes, and hurricanes combined. Stay cool and drink lots of liquids. You can find all of this information by visiting our homepage at cuyahogacounty.us. Now, before I turn it over to Dr. Harris, I want to share a piece of good news. Cuyahoga County has received the Distinguished Budget Presentation Award from the Government Finance Officers Association for our 2022 and 2023 biennial budget. This is the highest form of recognition in governmental budgeting. Now, we've been very careful, responsible, and deliberate in our budgeting process, so much so that our efforts have been recognized by the leading budget organization in the country. We would not have been able to receive this distinction if not for the collaboration between our fiscal office, our budget office, county council, and their staff. With all of their help, we as a county government are in as good a financial position as we've ever been. We're carefully spending taxpayer money for both big picture projects and for projects right outside your door, for neighborhoods, families, and your health. And we're putting our county in a great, great position for years to come. Thanks. And now I'll turn it over to Dr. Harris.
Thank you for having me this afternoon. And I am glad to say that Cuyahoga County is in green, and we're happy about that as well. And To first start off, I would like to say that this presentation today will have a brief summary of statistics to help us understand where we are in the landscape of COVID-19 right now. And then we will also have Dr. Prakash discuss clinical perspectives as well. So to talk a little bit about the statistics, right now, yes, we are in green. We are happy about that, but we must note that we're really close to not being so green. And I want to bring light to that. Some of the measures that we're looking at right now are the admissions rates. And our admissions rates right now for COVID-19 are at 9.8 per 100,000 residents in the county, and the threshold is 10. So we're really close. And so I think we should celebrate the small wins of being green, but also understand that when the numbers come out tomorrow, we might in fact be back in the medium classification. So I will start there with that point. I will also say that new cases are also one of the indicators that we look at. New COVID-19 cases right now, as of last week, was at 162 per 100,000 residents, and that's daily average of new cases. And the threshold for crossing over into the medium level is 200. So we're not too close, but yet it can easily change as well. And then third, we're talking about the hospital beds that are devoted to COVID-19 patients. And that number is really good. We're at 3% of our beds that are devoted to COVID-19 patients. And so we're far from 10, which is the threshold to turn from low to medium. So I think that we should celebrate, again, these small wins, but understand that we need to take some measures that we've been taking, obviously, to get to this status, but take them seriously as we go into summer and we realize that kids are going to be playing, they're going to go to camp, they're going to go to recreation centers. And so let's be mindful of the protections that we put in place as we enjoy our summers. The next thing I would like to do is really talk about what some of those protective measures might be. And again, these are reminders. These are things that we talk about on a regular basis. One will be get it tested. If you're going to be around individuals that you don't live with, consider getting tested if you're going to be in a congregate setting. Also, if you're having symptoms, think about maybe getting tested if you're having symptoms or if you've been around someone who has tested positive for COVID. This is travel season. Before traveling, think about getting tested. And when you come back, think about getting tested. You have many testing options out there. You can go to any of our testing locations. You can also do at-home tests. If you haven't gotten your at-home tests from the federal government, they are providing those at no cost. You could go to, let me make sure I get the covidtest.gov to request your test be sent to you and mailed to your home. Also, what we can do is get vaccinated. Yes, we have 63% of our residents that are currently fully vaccinated. That is very good, but we can do better. Right now, vaccinations have been out there for quite some time. People should probably have a little more comfort if they were a little uncomfortable about getting vaccinated. So consider getting vaccinated if you are eligible and if you have not gotten vaccinated to this point. Boosters. Boosters are readily available. And for the most part, everyone is eligible to get their first booster. So why not? Get your booster. And if you're eligible for a second booster, if you're over the age of 50, if you're at risk for severe illness, or if you're even in a situation where you have an immunocompromised system, please get your second booster. You can look up vaccination clinic sites by going to vaccines.gov or looking at visiting the site that County Executive Budish put up on the screen earlier, which is the State Department of Health's website for finding vaccines. And then lastly, we can talk about masks over and over and over again. I know Dr. Ganesh will talk about masks, but we can never get too comfortable where we're not wearing our mask. And one of my employees was just traveling over the weekend, and she was saying that masks are not being worn in the airports or on the planes. And so if others aren't wearing their masks, consider wearing yours just to keep yourself safe and those around you safe. And then I will finish up by saying that if you do test positive, please report that to ccbh.net. We do have a place for people to let us know if they have tested positive at home. And so we can make sure that those calculations are in our numbers as we look at what our case rates are locally. And then if you do test positive, also speak with your healthcare provider about getting treatments. And Dr. Ganesh talked about some of those treatments on our last briefing, but understand that these treatments really work best when they're taken early on in your infection. So as soon as you test positive, really discuss that with your provider as soon as possible. And I will turn it over to Dr. Ganesh to talk about some of the clinical perspectives at this time.
Thank you, Dr. Harris and Executive Budish, and thank you, Cuyahoga County. I just want to take a few moments to share my perspective and reiterate and clarify some of the things that Dr. Harris and Executive Budish have already presented. We've learned so much over the last several years of COVID-19. We see how globally connected we are, seeing the lack of vaccines, lack of testing to now an abundance of testing and vaccination. We've seen new variants come into play. We've seen waves, surges, and then now a low community transmission. We've seen people having long COVID as well. But currently we do have a low community transmission. We have low hospitalizations, low deaths. But I think it's all due to the things that we've put into place, such as the mitigation factors, and then all of our community getting, or majority of our community getting vaccinated. But I think it is still important to stay vigilant, stick to what works, and stay ahead of this pandemic as we see it evolve. So sticking to things that work, first, masks. I know we're all tired of it. We've been discussing masks for years now. But remember, it is the simplest, easiest, simplest way to stay safe, regardless of vaccination status. I don't think we need to wear a mask outdoors, but when you're indoors, close to others in public places, where it could be crowded, I do think it's important to be wearing a mask so you keep yourself protected and others protected around you. And of course, so we can enjoy the nice weather that we have now, or hot weather. Testing is another thing that we know works. There's an abundance of tests that are out there now. We have home tests, we have rapid tests that you can get in a pharmacy before flight. We have PCR tests that take 24 to 48 hours to return and are done in labs. And of course, the government is handing out tests as well that you can get for free. So if you do notice any symptoms, regardless, in my clinical practice, I've seen people come in with migraines and ended up testing positive, fatigue, different sorts of allergies or congestion, or thinking that they might have sinusitis that may or may not be very different from a previous infection of COVID-19 that you may have had. But it is essential to know and get tested early so you can stop transmission. And also talk to your provider about starting oral antivirals if you qualify for that. The third thing is vaccination. Vaccination is all about keeping people healthy, keeping people out of the hospital, and reducing our deaths in our community. We know it works. We've seen millions of people across the country be vaccinated now. We've seen improved numbers, just as we've discussed before, and reduced risk of long COVID. So it's the best way for us to get back to our regular life and having COVID be another respiratory virus that we see kind of circulating in our community. There is a lot of news now about the new vaccinations that have rolled out and approved by the FDA and CDC for those 6 months to 5 years of age. That includes Moderna and the Pfizer BioNTech vaccinations. The Moderna vaccine will be a 2-dose vaccine for the primary series. And the Pfizer vaccine will be a 3-dose series for those 6 months to 4 years. We can talk about the the intervals of those later, but it is important to get vaccinated at this age group because those are some of our most vulnerable in our community. They are getting a lot of vaccines at this time. So in my clinical practice, I do talk a lot about vaccines during this age group anyways, and a lot of parents are relieved that these are coming out now. And this is a regular part of these visits for this age group. So if you have any questions regarding the vaccines, please ask them now. But with that, I'll turn it over to Devin and Executive Budish.
All right. Thank you all very much for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So we can take a question. All right, no problem, no questions. Thank you all very much for joining today. That concludes this week's briefing. Thank you, and we will see you in a few weeks. Have a great day.